To Queen's Park next, where the province's Auditor General released her annual report.
The focus this year on health care. Among other things, the AG says Ontario is falling short when it comes to connecting residents with primary care. CTV's Queen's Park Bureau Chief Siobhan Morris is live tonight with the details. Siobhan.
Well, there was also a big focus in this report on billing. The Auditor General describes the system by which that's done as archaic, with not enough people at the Ministry of Health taking a close look at the numbers coming in. Ontario's Auditor General finds big gaps in monitoring doctor billing practices. In her annual report, Shelley Spence flags physicians putting in for over 100 hours in just a day, 365 days of work a year, and far more than their peers, sometimes all three.
Those were all very shocking to me.
The government estimates anomalies could cost taxpayers in the ballpark of $500 million a year.
If there is waste in the billing system, and we're not saying there is, we're just saying it needs to be reviewed. And if it could be recovered, you could use that money to hire more family physicians.
The parliamentary assistant to the Minister of Health, dismissive of eyebrow-raising bills.
Well, no, we're not. Maybe you're talking about hypotheticals. I'm talking about an actual process.
He explains healthcare and its billing system are complex.
So we need not automatically jump to an assumption.
The Ministry of Health says the problem cases the auditor identified are being investigated.
This isn't really about the individual doctors as much as it is about the fact that the government refuses to put enough people in charge of monitoring these things.
The auditor also flags a lack of collaboration and planning on getting Ontarians linked to primary care. While the province has boasted about clearing half of a waiting list,
Healthcare Connect is failing to meet the moment. Ontario health teams are saying it's not working, patients are not using it, family doctors are not using it.
Spence notes that only about 11% of those without a doctor are using the service.
Maybe if you advertised that it's available to people, it might start working.
Ontario hasn't updated its communication plan to tell doctors and patients about the program in a decade.
For generations.
This was the biggest year on record for government advertising, $112 million through the end of March. 38% of that bill covered ads the Auditor General describes as being mostly to foster a positive image of progressive conservatives.
It's important both before or after an election cycle for the public to be informed with nonpartisan government advertising. That is what we're doing. That is what we're committed to.
A rule change by the previous Liberal government allowed this kind of advertising.
That was the wrong thing to do. It makes me mad. Not as mad as I am about the way they're spending money right now.
The government's defending disorganized management of its PPE stock, something that's led to $1.4 billion worth of gloves, masks, and gowns
Literally being thrown away. Blown up in smoke.
The auditor says some of this stuff expired or was purchased post-pandemic in long-term contracts. The gear not always fitting the needs of the people who use it.
Yeah, well, I guess I would ask a question. Would you like substandard PPE to be used with your children?
Shelley Spence says she can't entirely blame the government for there being some level of waste because there was such a scramble to get your hands on PPE in the early days of the pandemic. Reporting live from Queen's Park, I'm Siobhan Morris. Nathan, back to you.
Thank you, Siobhan.